2019 novel coronavirus disease, commonly known as COVID-19. This presentation is being provided to you by San Joaquin County Human Resources Risk Management. Our objective today is to discuss what is COVID-19, talk about sources of exposure to the virus, hazards associated with exposure, how to protect yourself, what to do if you should get sick, and personal protective equipment. Within your departments, you will see numerous flyers and posters giving you guidelines on how to stop the spread of the germ that includes social distancing, hand washing, environmental cleaning. Please adhere to those guidelines. What is COVID-19? It's a respiratory illness in humans caused by a new novel coronavirus. Coronaviruses in themselves is nothing new. Commonly, they were found in animals such as cats, bats, cattle, camel. However, now we see them affecting humans. And symptoms can include, but are not limited to, fever, cough, shortness of breath. 80% of individuals that contact the virus will not have severe cases. However, 20% of individuals that contact the virus will develop serious, severe cases. It can cause pneumonia, respiratory failure, ICU care, and the worst outcome, death. Symptoms may appear 2 to 14 days after exposure to the virus. How do we get it? We get it by having close contact with an individual who's positive with the virus. Therefore, it's important that you maintain social distancing. Close contact is defined as within 6 feet for 15 minutes. Again, close contact means that you were within 6 feet of that positive individual for 15 minutes or more. That's why we keep telling you social distance. Stay out of that 6 feet danger zone. Don't be in that person's presence for 15 minutes or more. And if you have to be within that area, wear your mask. The time frame for having contact with an individual includes the period of time of 48 hours before the individual became symptomatic. How is the virus spread? It is spread through droplets that occur when a person sneezes or coughs within 6 feet. Those droplets can land on your mouth, your nose, your eyes, and get inhaled into your lungs. You can also, in some occasions, contact the virus by touching a contaminated surface and then touching your eye, your nose, or your mouth. There is no vaccination for COVID-19 at this time, but Public Health Services has given guidelines to help minimize the exposure. At the top of the list is washing your hands. Good personal hand washing hygiene. When you're washing your hands, you want to wash between your fingers, the palm of your hand, the back of your hand, your wrist. You're going to wash your hands with soap and water for 20 seconds. When you're thinking about 20 seconds, just sing happy birthday in your head. If soap and water are not available, an alcohol-based hand sanitizer will work. Avoid touching your eyes, your nose, and your mouth. If you have to cough or sneeze, use a tissue and then throw it in the trash. Avoid contact with sick people. Make the assumption that everyone around you may be carrying that virus. And with that assumption, keep your social distancing. Clean and disinfect frequently touched surfaces and objects regularly. If you're sick, stay at home. Personal, preventive, and environmental. You can take personal precautions, your hand washing, checking your temperature. Prevention, social distancing, staying away from sick individuals, environmental, cleaning surfaces. Within your departments have made readily available to you cleaning solutions that you can clean areas Don't just wait for general housekeeping services or janitorial services. Clean those high-touch surfaces yourself. Wear face coverings. Wash your hands again. Personal hygiene for hand washing is number one at the top of the list. There's a website right there that you can check and get more information. Cover your mouth with your mask. Make sure it covers your nose and your mouth. Make sure it fits snugly against your face. Do not touch your mask while you're wearing it. At the end of this presentation, there will be web links that you can go to see the proper donning and doffing of masks and gloves. I strongly encourage you to make sure you review both of those websites. If your mask gets damaged or wet, throw it away. When you're removing your mask, you remove it from your ears. Don't touch the front of it. Keep in mind that N95 respirators have been identified for use for healthcare workers. You can wear your paper mask or your cloth mask, but N95 are for those frontline employees such as healthcare workers. When you're selecting the mask, keep in mind professional appearance in accordance with your department dress code. You have questions about a mask, talk with your department to make sure it meets the department's dress code. You may not wear a face covering that is excessively large, such as a ski mask or motorcycle mask. No mask with inappropriate writing or graphics on them. Another way to prevent and to stop the spread is for you to self-monitor yourself. If you're sick, stay at home. Take your temperature. Ideally, it'd be great if you took it 2 times a day. If you have a temperature of 100.4, seek medical assistance. Other symptoms include coughing, difficulty breathing, shortness of breath, sore throat, chills, headache, muscle or body ache, sudden loss of taste or smell. If you're having any of these symptoms, touch base with your medical care provider. Prevention includes social distancing, wearing your mask. The county is doing things that we to try to assist also with the spread. We're doing policies and procedure changes, allowing flexible schedule, telecommuting, staggered shifts, and flexible work sites. We've also tried to replace in-person meetings with video or telephone conferencing and increase teleworking options. We've modified, postponed, and canceled mass gatherings. We've put in barrier protectors. You've seen plexiglass. You've seen floor decals on the floor to clearly identify the 6-foot distance for you. Public Health Services has put together guidelines for you to use to determine when it is time for you to release from isolation. In some cases, your release from isolation can occur on the 11th day. When to seek medical assistance. If you're having trouble breathing, persistent pain or pressure in your chest, new confusion, inability to wake up or stay awoke, bluish lips or face, these are possible symptoms and you should seek medical treatment. Environmental cleaning. You want to clean and disinfect high-touch areas regularly, particularly tables, doorknobs, light switches, countertops, handles, desks, phone, keyboards. Don't worry about the toilets. We don't want you to clean the toilets. For more information, you can go to the county's website, COVID-19 for employees, and also Public Health Services has additional information for you. There are lots of guidance, prevention guidelines, flyers, posters, what's happening right now. In summary, it is very important that you adhere to good personal hand washing hygiene. Wash your hands for 20 seconds with soap and water. When water and soap are not available, alcohol-based hand sanitizers. Avoid touching your nose, mouth, eyes. Practice social distancing. Remember, close contact is defined as being within 6 feet of an individual for 15 minutes or more. Clean and disinfect regularly, and if you're sick, stay at home. Lastly, please go to these websites to review the proper donning and doffing of gloves and masks. I thank you for your time. Stay safe.